Social work is a professional and academic discipline that seeks to improve the quality of life and subjective well-being of individuals, groups, and communities through research, policy, community organizing, direct practice, crisis intervention, and teaching for the benefit of those affected by social disadvantages such as poverty, mental and physical illness or disability, and social injustice, including violations of their civil liberties and human rights. A person who practices social work is called a social worker. In the UK, the title social worker is protected by law, and only those who have undergone approved training at university either through a bachelor or master's degree in social work and are registered with the appropriate regulatory body may practice social work and be called a social worker. Social workers typically undergo a systematic set of training and qualifications that are distinct from those of social care workers, care assistants or social care workers, who may undertake a social work role but not necessarily have the qualifications or professional skills of a qualified social worker. Currently, there is no formal qualifications or training to practice as a social care assistant, care worker, social care assistant or carer, but mostly ancillary staff are accountable to a qualified member of staff, such as a social worker. Research in the practice of social work focuses on areas such as human development, socio-legal, psychosocial, psychotherapy, counseling, social policy, public administration, social program evaluation, and community development. Social workers are organized into local, national, continental, and international professional bodies. It is an interdisciplinary field that incorporates theoretical bases from economics, education, sociology, law, medicine, philosophy, politics, anthropology, and psychology. History. The concept of charity goes back to ancient times, and the practice of providing for the poor has roots in many ancient civilizations and world religions. Even before the rise of modern European states, the Church was providing social services. The earliest organized social welfare activity of the Christian Church was the formation of burial societies, followed closely by provision of alms to the poor, shelter for the homeless, and care and comfort for the sick. Monasteries often served as comprehensive social service agencies, acting as hospitals, homes for the aged, orphanages, travelers' aid stations. It was not until the emergence of industrialization and urbanization that the informal helping systems of the church and family began to break down and organized social welfare services emerged to supplant it. The profession of social work is generally considered to have developed from three movements: the charity organization society movement, the settlement house movement, and a third, less clearly defined movement, the development of institutions to deal with the entire range of social problems. All had their most rapid growth during the 19th century, and all grew out of the church. Social work has its roots in the social and economic upheaval wrought by the Industrial Revolution, in particular the societal struggle to deal with poverty and its resultant problems. Because poverty was the main focus of early social work, it was intricately linked with the idea of charity work. For instance, it is common for modern social workers to find themselves dealing with consequences arising from other social problems such as racism, sexism, homophobia, and discrimination based on age or on physical or mental disability. Whereas social casework started on a more scientific footing aimed at directing and reforming individuals, other models of social work arising out of the settlement house movement, led by activists such as Jane Addams, emphasized political activism and community solutions. Currently, social work is known for its critical and holistic approach to understanding and intervening in social problems. This has led, for example, to the recognition of poverty as having a social and economic basis rooted in social policies rather than representing a personal moral defect. This trend also points to another historical development in the evolution of social work. Once a profession engages in social control, it is directed at social and personal empowerment. This is not to say that modern social workers do not engage in social control, and many, if not most, social workers likely would agree that there is an ongoing tension between these forces within the profession. For example, see the debate between structural social work and humanistic social work. Need to add references to Jane Addams and more sources on history of the profession. Practice. Social work is an interdisciplinary profession, meaning it draws from a number of areas, such as psychology, sociology, criminology, economics, ecology, education, health, law, philosophy, anthropology and counseling, or colloquially known as psychotherapy. It is not a single model, such as that of health, followed by medical professionals such as nurses and doctors. Thus, social work requires study and continued professional development to retain knowledge and skills in practice. As an example, here are some of the social work models used within practice: attachment, behavioral, brief therapy, cognitive, mental health, cognitive behavioral, critical, crisis intervention, ecological, feminist, medical or clinical, person-centered therapy, psychoanalytic, psychodynamic, existential, humanistic, sociotherapy, brief, transpersonal, body psychotherapy, radical, reflexivity, social exchange, safeguarding, solution-focused, systemic, systems, strength-based practice, task-centered, contemporary professional development. The International Federation of Social Workers says of social work today that social work bases its methodology on a systematic body of evidence-based knowledge derived from research and practice evaluation, including local and indigenous knowledge specific to its context. It recognizes the complexity of interactions between human beings and their environment, and the capacity of people both to be affected by and to alter the multiple influences upon them, including biopsychosocial factors. The social work profession draws on theories of human development, social theory and social systems to analyze complex situations and to facilitate individual, organizational, social and cultural changes. Its 7 core functions are described by Popple and Leininger as: engagement. The social worker must first engage the client in early meetings to promote a collaborative relationship. Assessment data must be gathered that will guide and direct a plan of action to help the client. Planning, negotiate and formulate an action plan. Implementation, promote resource acquisition and enhance role performance. Monitoring, evaluation, ongoing documentation through short-term goal attainment of extent to which client is following through. Supportive counseling, affirming, challenging, encouraging, informing, and exploring options. Graduated disengagement, seeking to replace the social worker with a naturally occurring resource. 6 other core values are: service, help people in need and address social problems; social justice, challenge social injustices; respect the dignity and worth of the person; give importance to human relationships; integrity, behave in a trustworthy manner; competence, practice within the areas of one's areas of expertise and develop and enhance professional skills. Qualifications. The education of social workers begins with a bachelor's degree or diploma in social work. Some countries offer postgraduate degrees in social work, such as a master's degree or doctoral studies. Increasingly, graduates of social work programs pursue postmasters and postdoctoral study, including training in psychotherapy. In the United States, social work undergraduate and master's programs are accredited by the Council on Social Work Education. A CSWE-accredited degree is required for one to become a state-licensed social worker. A number of countries and jurisdictions requires registration or licensure of people working as social workers, and there are mandated qualifications. In other places, a professional association sets academic requirements for admission to the profession. The success of these professional bodies' efforts is demonstrated in that these same requirements are recognized by employers as necessary for employment. Professional associations. Social workers have a number of professional associations, which provide ethical guidance and other forms of support for their members and for social work in general. These associations may be international, continental, semi-continental, national, or regional. The main international associations are the International Federation of Social Workers and the International Association of Schools of Social Work. The largest professional social work association in the United States is the National Association of Social Workers. There also exist organizations that represent clinical social workers such as the American Association of Psychoanalysis and Clinical Social Work. AAPCSW is a national organization representing social workers who practice psychoanalytic social work and psychoanalysis. There are also a number of states with clinical social work societies which represent all social workers who conduct psychotherapy from a variety of theoretical frameworks with families, groups and individuals. Trade unions representing social workers. In the United Kingdom, just over half of social workers are employed by local authorities, and many of these are represented by Unison, the public sector employee union. Smaller numbers are members of Unite the Union and the GMB. The British Union of Social Work Employees has been a section of the community since 2008. In 2011, the British Association of Social Workers launched a trade union arm for the second time called the Social Workers Union, but this body is not recognised by the TUC or by any employers. Role of the professional. The main tasks of professional social workers may include a number of services such as case management, counselling and psychotherapy, assessment and diagnosis of mental disorders, child protection welfare, human services management, social welfare policy analysis, policy and practice development, community organizing, international, social and community development, advocacy, teaching, and social and political research. A historic and defining feature of social work is the profession's focus on individual well-being in a social context and the well-being of society. Social workers promote social justice and social change with and on behalf of clients. The term client is used to refer to individuals, families, groups, organizations, or communities. In the broadening scope of the modern social worker's role, some practitioners have in recent years traveled to war-torn countries to provide psychosocial assistance to families and survivors. According to the Substance Abuse and Mental Health Services Administration, professional social workers are the nation's largest group of mental health services providers. There are more clinically trained social workers over 200,000 than psychiatrists, psychologists, and psychiatric nurses combined. Federal law and the National Institutes of Health recognize social work as one of 5 core mental health professions. Social workers in literature. In 2011, a critic stated that novels about social work are rare, and as recently as 2004, another critic claimed to have difficulty finding novels featuring a main character holding a Master of Social Work degree. However, social workers have been the subject of many novels, including Bohjalian, Chris. The Double Bind, a novel. New York, Shira Hart Books. ISBN A9781400047468. Cooper, Philip. Social Work Man. Leicester, Matador. ISBN A97817807885,087. Desai, Kishwar. Witness the Night. London, Beautiful Books. ISBN A9781905636853. Gage, Amity. The Folded World. New York, Other Press. ISBN A1590512,480. Irish, Lola. Streets of Dust, a novel based on the life of Caroline Chisholm. Kirribilli, NSW, Eldorado. ISBN A1864120,010. Green-Lee, Sam. The Spook Who Sat by the Door, a novel. African American Life. Detroit, Wayne State University Press. ISBN A0814322468. Conrad D., Gyao Paragraph Gy. The Caseworker. Writers from the Other Europe. New York, USA, Penguin Books. ISBN A0140099468. Henderson, Smith. 4th of July Creek, a novel. ISBN A9780622286444. Johnson, Greg. A Very Famous Social Worker. Bloomington, Indiana, iUniverse Incorporated. ISBN A9781450285483. Johnson, Kristen. Unprotected, a novel. St. Cloud, Minnesota, North Star Press. ISBN A9780878395897. Kalpakian, Laura. Grace Land. New York, Grove Wiedenfeld. ISBN A0802114741. Lewis, Sinclair. Ann Vickers. Garden City, New York. Doubleday, Doran and Company. OCLCA 288770. Mengestu, Dinah. All Our Names. New York, Alfred A. Knopf. ISBN A9780385349987. Sapphire. Push, a novel. New York, Alfred A. Knopf. Random House. ISBN A0679446265. Are the basis of the movie Precious. Smith, Ali There But For The, Hamish Hamilton, Pantheon. Ungar, Michael. The Social Worker, a novel. Lawrencetown, N.S., Pottersfield Press. ISBN A9781897406265. Wienbrun, Martin. King Welfare. Bakewell, Peak Publish. ISBN A9781907218184. See also. References. Further reading.